Hello doctors, friends of homeopathy and students of homeopathy. Today is the 1663rd day of uninterrupted daily webinar of Ifph. And today's our guest is Dr. Rohit Sharma, a registered homeopath from Canada. He is running a clinic at Ontario, Brampton, Ontario, Canada. He has more than 19 years of clinical experience, and his clinic's name is Clinic Homeopathy and Health Inc. Let's welcome Dr. Rohit Sharma for the topic Homeopathy for Childhood Behavioral Issues. The topic is Homeopathy for Childhood Behavioral Issues. Let's welcome Dr. Rohit Sharma. Doctor, you can unmute yourself.
Yeah. Am I audible and I'm visible to all of you, sir?
Yeah, it is.
Okay. Good morning. Sorry, it's good morning here, but it's good evening over there. Good evening to all of you. And thank you to the faculty of Ifph for giving me the opportunity to share my views on this wonderful platform. I have been attached to this platform from past 2 years, and I highly appreciate the efforts of Ifph to promote homeopathy, to promote homeopaths. It's very, very, very wonderful. I'm very thankful to Dhanesh sir for allowing me to fix this date, to giving me this presentation. So I was privileged. I had practiced over 20 years in India, and recently from past 8 months I am practicing. From 8 months I am in Canada. So recently I have started my clinic over here in Brampton, Canada. So whatever was my clinical experience, it was in India. I will try to help the community over here. Today's my topic was that today's the topic is that we met some behavior issues in children around us, and number of times parents, health workers, they ignore it while they came to a homeopath. Even if the homeopaths are practicing on physicals, they do ignore it. Even it's very hard for them. It is hard for the practitioners who are giving medicines or mental symptoms. Often they left the totality, or they prescribe on single rubric. So it's my privilege. It was my good luck that I have got the sub mentors and my hard work, that I always go for the totality. But today it's a very vast topic, and it can't be completed within 30-40 minutes. It will definitely take 3 to 4 days to complete such a sensitive and hard topic. But what I am here today is some rubrics and some discussion which we often don't consider, and there are some lovely rubrics in homeopathic repertory which we often don't use, don't see, don't consider them. So without any delays, I would like to start with the first topic. And before I start, I forget to greet everyone, every participant who is here, who is listening to me. And now I will start. The first thing which I have noticed, and you might even have noticed in your clinical practice, that sometimes the child gets scared about the diseases. They get scared about the um, diseases that they may get the same problem. So I would like to share this thing. This is the fear contagion that is in children. we often consider the broader one, that is rubric fear disease of impending contagious epidemic disease that carries 18 medicines. But if you see this lovely rubric, it has fear contagion children in. It carries 11 medicines. It includes arsenic, calcarea, carcinogenic initia, lectin, lactasis, metrinum, sorinum, silicia, sulfur, and cephalinum, which are all are very polycrest remedies. So what exactly about this? I would like to say that fear contagion in children refers to the phenomena where kids pick up and adopt fear from other, often through the observation, imitation, or social learning. This can be seen through various channels. First of all, am I audible?
Yes, you are audible, but you can just enlarge the slide, that it will be more visible.
Okay.
No, it's not now. Yeah, so
Okay.
this much only.
So,
right.
First of all, the parents, child transmission. Children may receive to learn the fears. Children may learn fears from their parents or caregivers. Second is the peer influence. Kids may adopt fear from their friends or classmates, especially during the social interactions. Media exposure. Children may develop fear from watching scary movies, TV shows, and news. There are factors contributing to fear contagion in children. Usually, children under the age of 7 to 8 years are more susceptible to fear contagion. And second is the temperament. Some anxious or sensitive children are more prone to adopting fear. And third one is the social learning. Children learn by observing and imitating others. What would be the signs of contagion in children? That is excessive worry. There will be certain changes in their behavior, refusing to participate in activities due to fear. Physical symptoms may accompany with the headache, stomachache, sleep disturbances. Now, how we can prevent this? First of all, the parents and caregivers should manage their own anxiety about the children. They often get anxiety when they came to physician. They are self in the state of anxiety. Second one is to encourage open communication. Talk to children about their fear and worries. Promote a sense of safety and security. And most importantly, encourage. There are relaxation techniques, problem solving, and positive self-talks. And if it comes to the homeopaths, we can consider the totality, but we must consider those rubrics which are specially found in the children's. So this is one thing which I have discussed about the role of the contagion, the fear of contagion in children especially. It can affect their behavior. Now, the another important topic of is stranger. Stranger, we often think that it's something unusual, but whenever we got exposed to certain strangers, our child can get in some problems. There are some rubrics which are related to the strange activities. The first rubric is mind, strange, presence of stranger, aggravates. Now, it could be the first day of our child at the school, or it's our the newcomer that had came to our house. Maybe he might be the stranger to the child. Whenever child encounters strangers, they may experience fear and anxiety. They feel scared, nervous, and uneasy. They feel shy, that withdrawing or hiding from stranger due to feeling of apprehension. Separation anxiety could be there, become distressed when separated from parents or caregiver. And there is an anxiety. Mostly the child under the age of 3 or 4 years show this more. And when we count the temperament, some child are naturally more cautious and anxious. Third is the parent-child attachment. Child may secure attachment, may feel more comfortable around strangers.
So sorry
Now,
to interfere. The slide is not moving.
Slide is not moving. Now, let me change it. Yeah, sorry. Yeah, because I'm using the mobile here. So let me give. I have discussed this one about the contagion slide. Now we'll go with the second one. Yeah, now this is about the problem of stranger. Now, when we look at the mind section, we look at the stranger. Presence of stranger aggravates. It carries 25 medicines. Basically, it's a broad rubric. It's 25 medicines. But when we consider the same rubric in child, we have important 7 polycross remedies. Even if our child, there is a sub rubric that child cough at sight of stranger, it carries 4 medicines. Now, the other manifestation which I have told earlier, that anxiety is stranger in presence of. Whenever our child or the children are in the presence of a stranger, they feel anxiety which can be seen on their face. It carries 4 medicine, that is ambragresia, britacarb, carbovagen, stramonium. When we go down and we see that there is another beautiful rubric, that mind, company aversion to, stranger aversion to, presence of, urination while. So whenever it could be the with the big one, but whenever our child, the children may have be given complaint from their teachers to parents that he's not good in urination or stool while he's good at home. So we must consider all these things, that it might be due to the strangers, it might be the anxiety, it might be his or her confidence. So if he or she, adult one, is not able to pass the urine in front of others, it doesn't mean that the child may not suffer the same. If we accompany the other symptoms, we can have, there is a, now mind anxiety stranger in presence of ambragresia is present, but in urination, he can't pass urination in front of strangers. Ambragresia, hypersulf, lyco, meteoric acid, nitramur, and tarantula is there. And similarly, if he can't pass stool in front of, if the company is in joining somewhere, then ambragresia and nitramur is there. So strangers, we must ask about the child what exactly he is facing. So these are the few rubrics. Now, this is again a very common thing nowadays, that is FOMO. That is FOMO. What exactly it means, that FOMO stands for fear of missing out. It is present not only in the children, but the bigger one also, adults too. But what I have noticed, that it should not be missed. FOMO refers to the anxiety or apprehension people feel when they think the other might be having a more exciting, fulfilling, or successful experience. This can lead to overcommitting, social media obsession, anxiety and stress. It can be triggered by the social media post. There may be fear to regret, desire to social validation. What we can do in children, we must prioritize them, focus on meaningful relationship, and practice meaningful mindfulness activities. Now I will discuss some problems which usually children face and in their school. What problem they used to face. That there are certain problems in the school. Most of the child, they complained about the problem of headache, and we consider it as a routine problem. Let me first search out, just a second. Yeah, this is. So they often said that the children have pain in the head, or they have pain in stomach and the pain in abdomen and diarrhea, and what the things are there. What I have studied that if the child has pain in head, that is school children, we have 29 medicines, including calcarea phos. But when we cover up, when we see this, that is child used to say that I have pain in my stomach, or he can say that pain in abdomen. When I club both these, they carry the single medicine. They have the calcarea phos. Again, if we have the rectum diarrhea children in school going girls, we have calcarea phos and phosphoric acid. Similarly, if the complaint of headache is accompanied by diarrhea, we have calcarea phos in the medicine. So what I have seen that we never consider the calcarea phos on those complaints, although we have to take the totality, but sometimes we have very particular uh, problem, that if the child has pain in his stomach, in school going children, sorry, which I have told you that calcarea phos was the common medicine. So it doesn't mean that in every case we will prescribe the calcarea phos, but we must consider those rubrics which covers the children separately. Apart from taking the big rubrics, which is our priority, we must not left the smaller rubrics which carry the single or the more than 5 or 6 or 7 drugs. It may lead to the sharp selection of the remedy out of 4 or 5 considerable medicines. Now another rubric, a beautiful rubric is there, that is confidence want of self school in. Some child, they don't have confidence in their school, especially in the school. They are very good at their home, but they are not good in scenario of confidence at their school. So we have 7 medicines including calcarea phos. It is calcarea phos, carcinosin, ferrum phos, phosphorus, pulsatile, and silicea. Some child get aversion to school because of the anxiety, because of her or his complaint. So school aversion to, again, there is calcarea phos in this rubric, but along with that bacillinum, calcarea carb, and nettermure are there. So you can we can approach the case from a long case history, and we can start taking our case from a small thread, from single rubric or the single thing, whatever be the parent or child is telling us. We must be very careful while what child is doing in front of us, and what exactly in his own language he is describing his ailment to us. Maybe he may came to us and say that I don't want to go to the school, and we miss the point that why you don't want to go to the school. Or parent may interrupt here and say their own version that he don't study, or he don't, whatever be the complaint, they can add on. But if we carefully understand that thread, we can reach the right conclusion. Again, there are 2 more rubrics, that are absent-minded children, school children. there's Brata carb and dullness children, school children, carbo veg. Surprisingly, I have never seen and given carbo veg, but it's during this lecture, I have seen that apart from my clinical experience, I have seen carbo veg in theoretically in many rubrics, and I have never used it, but certainly in future I will consider it, because during preparation of this lecture, apart from my clinical knowledge, I came to know about the many things which I have never studied earlier. So now going further, there is a rubric that is ailments from domination, which is a very big rubric, and I have used it. Every homeopath who's practicing on mind has certainly used it, that ailment from domination from a long time, ailment from domination in children by parents from a long time. But when we go down and we see that there are very beautiful rubric, that is domination children in parent control, long history of excessive harsh upbringing. Sometimes the parents are harsh for a long time. Children used to told us that what type of parenting they had in their childhood. They might be 16, 17, 10, whatever be the age, they can told us, they can tell us that what type of upbringing they are facing. So in harsh upbringing, we have calcarea carb, calio-ad, and nitric acid. Surprisingly, apart from carcinosin, calio-ad and nitric acid, I have never used, but now I have came across these two medicines too, that we must consider all other options too. Another, there is a rubric domination children in parent control, long history of excessive religious upbringing. That is religious upbringing, which is very, very, very sensitive point. Most of the time, we don't think that the parents are, what parents are teaching to their children. During religious upbringing, it's my way that I usually ask parents not to bound their children in certain parameter, because it may trouble him or her in the future. Like there is a rubric that aversion meant to women in due to religious reasons. It carries a pulsatile and sepia and few more drugs. But what I have seen in my clinical life, that usually when female came to us at the age of 25 or 27, they usually, either the husband or the woman complained that that I don't have sexual feelings, or I don't have any interest in sexual relationship. It might, when we go into the depth, when we ask that from where you such get feelings, then most of the time she told that her parents told that it's not good, it's bad. So but the parents forget that after the marriage, everything will be fine. But that small child, that he or she had got the information in their past, is still working, and still she's biased to that. So we mostly consider sepia, pulsatilla, and other polycrest, but even I have never used, and I think most of the homeopaths who do consider the mind symptoms have ever used the Manzanella medicine for that. So there's a beautiful rubric that domination children in parent control, long history of excessive religious upbringing. So we need to explore more this medicine, and we need to explore more the mind of the child, so that we could get the right simillimum. It's not the pulsatilla, it's not the sepia, it might be the Manzanella. Even I have not used, but I think that in future, now I will consider it, it will be there in my mind. Now I will touch the another a beautiful part of every child's psychology, which is a beautiful rubric is there, and we often don't use it. That is excitement, emotional, and there is sub rubric excitement, emotional. Children are ill at certain moments. Very beautiful rubric, and it carries 17 polycrest remedies, good remedies. Even very honestly, even I have not used, and I have already told that I'm very much thankful to the faculty of Ifph, that due to that we prepare our lectures and we came across the new things and we used to discuss it. Maybe the faculty member or the participant, they might be using the same and they can guide me that they have used this rubric, but now I will definitely use this rubric because it's broad rubric. It carries 17 medicines and most of the medicines are very polycrest. It has aconite, belladonna, calcarea, capsicum, carboveg. Again, carboveg is there. Colchicum, ignitia, lachesis, lycopodium, murxol, opium, sorinum, pulsatilla, sepia, staph, thuja, and tuberculinum. So earlier I have told that carboveg, we have never think about the role of carboveg in children apart from the flatulence or something that, but it is very good when we club together on the mind symptoms too. Now, coming more forward to a very common rubric, which carries only two medicines, that is ailment from punishment. Ailment from punishment, the child may get the punishment either from the home or from the children or from their any place. In some countries, children used to do jobs at the shops or whatever be the place. So this could be the thing where they get punishment. We have only two medicines, carcinosin and netramure. When we will now, child may come or the children may come with the same thing that he got punishment. After that punishment, he got ill and get emotional at certain points. So apart from the staff, apart from the other medicines, apart from the colocynth, these two medicines must be there in your list, that ailment from punishment. Now another rubric, in a beautiful rubric is there, that ailment from warmth and security at home, lack of in children. When children get lack of warmth or lack of respect over at his home, so there is a medicine leccan. Leccan is there. While the similar, a beautiful rubric, another rubric is that that is mind behavior problem, children in at home but good at school with strangers. Child has behavior issues at the home, but he has not such issues with even the strangers at the school. So, and there is also one more rubric, that discord between the children and parents. Whenever the parents don't have a good relation with each other or they fight with each other, ailments from discord between the parents and mind behavior issues for children at home but not in the school with strangers. One medicine is surprisingly common, that is lycopodium, which is common, but in this rubric, which the child is very good at home but not good at the child is not good at the home but with good at the strangers in the school, carries lycopodium, thuja, and tuberculinum. These are the three medicines which are which they feel bad at home but they are good with strangers even at a school. Now the another beautiful rubric is there, uh, and I have treated a case with that, that is mind writing difficult in expressing ideas in. However, I this is this was a case for me. A mother came to me with his child and told me that he lacks in studies. I often get 5 marks out of 50. I asked them what is the problem with him. He told me that he can't write properly. I told him to write the simple word Ram, R-A-M. I told him that it is a very Ram, Sham, it is very common words. I asked him to write the Ram in Hindi. So what he has done, first of all, his mother, his mother told him that write Ra, then A, then M, and then make a line over that, over the at the top. So what was that? I immediately tried. At that time, I tried to find what exactly this is and where it will be there in the repertory. So by spending some time from a thread, I found that mind writing difficult in expressing his ideas. So he was not able to write the same thing. And I remembered that in there is a medicine lycopodium in it, and I have given the same medicine which favored him, and the case was solved. He was able to write in the right direction and get um, appreciation from his school. So it sometimes we take such broad rubrics, and when we take the broad rubrics, it's certainly that Lyco would be there, pulsatilla would be there, but when we have to eliminate the rubrics, when we have to cut down the rubric, when we have to search the peculiarity, then we have to consider this those threads, such threads which are which we you have to write down separately on your right side. If you are writing the whole case on this side, have you must write down those threads. Similarly, I was having a case of cyst in the neck. So while I was dealing with that case, her mother, I was asking about the nature, and she told me that she has habit of eating word what she has used, the biting the flesh or the portion around the nails. So it was not biting nails, it was the area beyond or around the nails, like this region, nails around the nails. She used to eat of hand and feet. And now again, apart from those things, I took this thread, I, I take the help of repertory, and I found in the mind biting the finger, finger, front of finger. So front of finger is this, and there was a medicine, a carcinosin in that. However, his whole case was also showing points toward carcinosin, lycopodium, something else. But this is something uncommon, that biting along with nails, the flesh around that, the portion, soft portion around the nails, she was biting and eating, even of the big toe, or the foot. So I used carcinosin, and in that case, and that too resulted in good way. So if I move forward, now there comes a very sensitive topic again. Parents used to come with this thing that uh, the child is abusive. Sometimes we got the rubric that child is abusive. So child is abusive. If we use the rubric abusive children toward parents, it has 20 medicines. But if we consider the child abusive to anyone, it has 25 medicines. Now we must consider the both rubrics. Only 5 medicines are missing, but we must have a look on those 5 medicines too. It's not meaning that we will not consider the other one. We will left the 5 medicines. Now, surprisingly, most of the medicines are common. I have seen that there is a rubric, child abusive causeless and abusive weeping with. We usually found the children, they abuse sometimes causeless. There is no cause. It may be toward parents, it may be toward anyone, but surprisingly, stramonium is not in the children abusing parents. These two rubrics have the common medicine, that is stramonium, but stramonium is not present in children abusing toward parents. So if we consider the child abusive parents, we will miss the stramonium, which is a very, very, very important child remedy. So abusive causeless along with abusive weeping with covers only single medicine, which is stramonium. However, stramonium has so many problems due to fear. Now, if we'll go further, that abusive mother towards, it carries two medicines, sepia and thuja. Surprisingly, if we'll see that thuja is also common and excitement emotional children in ill at certain age, and surprisingly thuja is their desire pleasing desire to please others. So thuja, who is abusive to mother and who has desire to please her others, and emotional excitement children are ill at certain moments. Under these three rubric, thuja is common, and we never used to give thuja to children. We don't consider thuja as a remedy, but thuja is a wonderful remedy in case of children. If we found these all the types of rubrics along with bad effect of vaccination, thuja might be the right choice to start and treatment for a child. Even surprisingly and very importantly, I have seen that bad effect of vaccination. We used to prescribe thuja, cilicia, and there are medorinum, but um, ailment for vaccination, bad effect of vaccination in children, there is a single medicine, that is carcinosin. We never we use the carcinosin, but I have treated so many cases with carcinosin in my practice. Now move forward with another rubric, that is taciturn mutism in children. Taciturn mutism as children, that there is excessive shyness. Taciturn refer to a person who is uncommunicative. Mutism is a term used in some culture to describe a child who is extremely shy, introverted, and unresponsive to social interaction. However, it could be normal to some of the extent in children because it's part of their childhoodness that they are shy. But when it crosses the limit, we must consider it. Extreme shyness, avoiding eye contact, hiding himself in social situations, limited communication, speaking very little or not at all, even with familiar persons, resistance to interaction, showing no interest in playing or engaging with others. What would be the possible causes of mutism behavior in children? That is temperamental factor may be there, environmental factor may be there, development delays can be there. Now what we can do if we met certain situation? We must consult an homeopath, or we must consult and the child specialist for his betterment. Professional help, like I have already told you, that psychologist or therapist, and provide a safe, supportive space for the child to feel comfortable and build trust. Now we have a beautiful rubric, that taciturn mutism children in. It carries, when we cover the rubric, the taciturn mutism, it has 4 medicines, but when we consider that in child, it carries only 2 medicines, which are lycopodium and agaricus. Now, going more briefly, I have touched few rubrics and few conditions which we used to met in the clinics, but either they are ignored or they are not given the priority sometime. And sometimes, like I have already told you, that medicinella is a medicine, thuja is a medicine. We don't consider medicinella, we never used to consider to prescribe this medicine to the child. But now I came to some common rubrics which are very important. They all homeopaths, they know them better. That is that, like the rubric is autism children, it carries 7 medicines. There is a beautiful rubric that anxiety children. I must share a slide over here. Yeah, so I was there at that point, that autism, that there is ailments from death of loved one. I have discussed the above topics, that is ailment from death of loved one in children. However, there was a broader rubric that ailment from death of loved one, but in children may notice the same thing. We used to met such cases too. That is, now the autism children, it carries 7 medicine. Now anxiety children it carries 21 medicines. We often neglect that children may get the anxiety. We have to come closer. We have to ask more about these things to the parents, to the child. It may be in the infant. Now anxiety children, it carries 21 medicine, but in under the sub rubric there is infant while lifting from a cradle and rocking during. If you will open the repertory, you will have the another these 3 sub rubrics. Now common in the biting is a very broad rubric, but when we consider in children, it carries 12 medicine. Biting clothes, bulimia. In bulimia, there is a single medicine, carcinosin. Capriciousness, clinging, concentration difficult children in. I have discussed the one rubric in prior, that concentration difficult children in school going, and there is concentration difficult children in. When we club those things, there might be a number of I would like to say now. I have already what I have discussed previously, that confidence want of self school in, absent minded school in, dullness children school during, and now concentration difficult children in. It might be at home, it might be at the school. Now there is one more difficult topic, difficult scenarios, that mind confidence, want of self confidence, self depreciation. When it comes that mind confidence, want of self confidence carries the 39 medicines. 39 medicines are there in mind confidence, want of self, 39 medicines. But when we consider it in children, importantly, nasa is there, only single medicine. There is lack of confidence, if he or she feel bad, then there is nasa is the medicine. So moving forward, another rubric is cottage, too much children in. Now it's a behavior, it could be the normal phase in the child, but when it is very much increased, we must consider it to prescribe as a medicine. Now why do children used to do this thing? Courtship is basically the flirting. It could be depending upon the age. If the child is below 5, his reaction would be different. Below 10 would be different. What to do? They used to do it for the attention, for manipulation, for flirting. And what we have to do? We have to set the boundaries. We have to set the boundaries so that he could be cured. So these are the rubrics which I have found, which even some of them I have not touched in my practice, but now I will definitely consider them. So if I go further in the journal, there are some beautiful rubrics like journal development arrested. Now development arrested is basically belongs to the child, but there is a rubric journal development arrested, journal development complained of. Under the development, there is arrested, there is complained of. Sometimes the growth is very rapid and sometimes the growth is very slow. So there are 4 rubrics under in the journal section under development, that is arrested, complaint of, rapid and slow. And there's one more beautiful rubric that is specially exclusively related to children, that is journal development of children arrested. That is a separate rubric. While in the cross reference, in the mind, there is a rubric retardation mental children in. It carries 13 medicines. So it doesn't mean that apart from the case taking, what I want to convey the message that it is very important to take the case as a totality, his desire, aversions, but while selecting a particular remedy, you have to consider those small rubrics. And like we have 5 medicines now, how you will eliminate? Either you must be very clear in the theme. Sometimes theme is same, but if you have a certain clear cut particular symptom in the form of authorized rubric, select the remedy in a good way. So this is all that I have compiled for today. Now I can share a case if the faculty allow me. Otherwise, it's open for all to discuss or to ask something if time permits. So I
Yes,
have
sir.
not touched.
The thing is, how much time it will take to share the case? Because we
It's
only
very.
have a few more minutes.
I will take only 2 to 3 minutes. Only 2 minutes.
2
Okay,
minutes you can,
sir.
please.
Yeah, a child came to me a child came to me with his father. His father told me that he is having the problem of dandruff over his head, and he is not good in eating. So I asked about his nature. So his father told me that he is very abusive toward me. He used to hit me. He's an abusive child, and these were the mental symptoms. I asked for the what about his appetite? He told me that he used to eat salt in going the kitchen. Separately, he picked the salt, and he used to take the ice too. And it has a habit of wandering or traveling. He like. So when I club all these things, you are very familiar to tuberculinum. The tuberculinum was the choice of my remedy. And after 1 month, when he came, what I have noticed that earlier his face was like that. He was a angry type of child. But when, like I can say that it was a psychotic face or syphilitic face, I don't know. But when he came to me back after 1 month, his face was very normal, and I was very happy that apart from the dandruff and his appetite was improved, his nature was also improved. Now, very interestingly, what I meant to say in this case, his father was having the skin problem, which I was not able to treat. Later, her wife came, and I asked about the father of nature, that I am not able to cure him. Let some like your husband has told me about the son, you must told me about your husband. So she told me that he is copy of his son. He is copy of his son. So I suddenly got some realization that I take a second and I prescribe tuberculin to his father. He's having problem over here, and sir, you don't believe, within 7 days the problem was cured, and I was not able to treat him from the past 1 month because he was not giving me the right information. So what exactly our homeopathy is, if you are able to treat the child or a particular family member on certain traits, these traits are common genetically in father or mother too. So we can help the family. Homeopathy is such a good science that we can help a family. So this was the all I have to say. If anyone has any questions or any suggestions regarding my session or for me, I would be very thankful to all of you.
Thank you. And it's very informative, picking up all the rubrics, and it's a great pleasure to be with you. And it's time for an open discussion. A few more minutes for us to have discussion with the speaker. You can raise your hand. Let me welcome Dr.
I have not touched here about the fears of children, because I have seen that in this platform it has been discussed earlier. So I tried that apart from my clinical experience, I must touch those topics which I have not yet seen here.
Yeah, it's also a very peculiar rubric I found, and that is at home. The child is not good with strangers, but good in school, even with strangers.
Yeah. Yes, sir.
That's a nice rubric. And
Yes, sir.
tuberculum, tuja, and lycopodium.
Yes, sir.
And
Even,
likewise,
sir,
lot of rubrics you pointed out.
sorry.
Likewise, you pointed out a lot of rubrics. It's very strange, and it will be very much good for us
Actually,
to point out a medicine. And apart from the behavioral aspects of all these things, let me ask you another question. In Canada, is it possible to treat all children with behavioral disorders with homeopathy? Is it possible? And what is the prospect of that in the treatment of children in Canada? Can you just explain a little bit?
Sir, in Canada, what has been told to me, that you can't make diagnosis. Like, I can't make diagnosis that child is suffering from anxiety or child is suffering from the tachytrum mutism, or the child is suffering from any problem. You can't make a diagnosis. The family physician over here will make a diagnosis. I have a case of autism, but it was diagnosed by his family member, and then we can say that we are treating such condition, but we can't make diagnosis over here. We have certain limitations in the Canada, or limitation, or you can say that they are not yet that number of homeopaths or the strong faculty over here, but they are doing, at least they are doing good for the homeopaths to practice over there. That I'm privileged to do the 20 years of practice in our India. I have huge experience. I have cleared their all the requirements, and registered myself with College of Homeopaths. So I am allowed, but I have to follow their rules. But it's good. We can treat the problem, sir. We can help the society over here.
Yeah, sure. By listening your session itself, we are very much confident that we can do good in Canada with good homeopathy also. And on behalf of Ifph, I think it's the time to conclude. On behalf of Ifph, I thank Dr. Rohit Sharma. You should please come again back to our forum, and that we can again discuss more. And it's the time we need to conclude, because another session is on to start. So
thank you, sir. Thank you very much.
Again, thank you for the session.
Thank you very much.
Sir. And I think I need to conclude today's session, and I need to hand over the session to Malayalam, Dr. Manoj.
Thank you, Dr. Binduraj. It's a really good session, as well as the rubrics have done an extensive job. There is no doubt about that.